Hi, I am Dr. Parul Katiyar and I am a fertility specialist at ART Fertility Clinics. So if you are trying to get pregnant and if you also suffer from excessive pain during a menstruation, or if you have pain during contact or a constant dull pain in your pelvis which keeps radiating to the back or to your thighs, then this video is for you. Because these are symptoms which may be associated with a common gynecological disease which we call as endometriosis. Unfortunately, this disease is also associated with infertility. So what is this endometriosis? Well, the term endometriosis is probably derived from endometrium. And this endometrium is a lining which grows every month in the womb or the uterus in order to prepare a bed for the small little embryo to come and attach itself. And therefore, it is very important for the embryo to be able to successfully grow into a successful pregnancy. However, every month the uterus keeps doing this process, which means that whenever there is no pregnancy, the uterus has to kind of clean itself. And this process of cleaning means that the endometrium that has grown is broken down, or it gets broken down into small pieces and is shed as menstrual blood during the menstruation. So this is a cyclical phenomena which happens in a way to prepare the uterus for the pregnancy. If there is no pregnancy, it comes out and a new lining starts growing. And this is something very normal. But sometimes these cells which grow inside the womb to prepare the uterus for the pregnancy may abnormally start growing outside the uterus. This can happen anywhere in the body, but most commonly it is seen in the pelvis, outside the uterus, close to the fallopian tubes, in or around the ovaries. Now the problem starts here. Why? Because the endometrium is responsive to the cyclical changes in hormones, and therefore it will continue to behave in the same manner, which means it will grow, and if there is no pregnancy, it will also break down and shed. Uterus has its natural opening through which the endometrium is shed as menstrual bleeding. But this opening is not present inside the pelvis. So therefore, every month when the endometrium grows and sheds, there is some bleeding around these endometrial implants. And this bleeding leads to collection of blood over there. It may also lead to inflammation. And this inflammation will lead to a presence of abnormal cells which may not be very helpful for pregnancy, and ultimately can lead to the development of scar or adhesions because of constant irritation around that area. This may also lead to formation of cysts within the ovary, which are nothing but blood that is shed every month and is unable to escape. And these cysts are called as chocolate cysts or endometriomas. As a consequence of this inflammation and adhesion formation, women start having the symptoms of pain, constant dull ache, severe discomfort during contact, etc. And also, this can also lead to abnormal cells in the places where they shouldn't be. And this can lead to infertility in women as well, because the scar tissue may prevent the development or prevent the motility of the tubes. The endometrial cyst may affect the egg quality as well as the quantity. So a lot of factors, some of which we know and some which we still don't know, contribute and lead to infertility in women suffering from endometriosis. Therefore, it is very important to get yourself evaluated if you have one of these symptoms, and especially when you are trying to get pregnant.